Hello, my name is Tyler, and I will be presenting the first portion of this presentation, and Johann will finish the second half up for me. I would like to thank everyone for taking the time to view our work and to learn about the impact of Alzheimer's disease on the U.S. healthcare system. First, let me explain what Alzheimer's is and what it is that is believed to cause Alzheimer's and some of the symptoms of Alzheimer's disease. Dementia is a very broad term used to describe a number of brain diseases that impact the thinking and reasoning of those with dementia. Alzheimer's is the most prevalent form of dementia and it accounts for 60 to 80% of all dementia cases. Alzheimer's patients express excessive amounts of structures called tau tangles and amyloid plaques, which cause significant brain atrophy or shrinkage. The sections of the brain most affected by this atrophy is typically the hippocampus in the temporal lobe, which is responsible for memory and emotion. This loss of neural tissue progresses over a number of years and leads to a number of symptoms which progress from mild confusion and behavioral changes to complete loss of independence. Alzheimer's is separated into two different classifications: early onset and late onset. Late onset Alzheimer's is the most common and is believed to be mainly caused by external factors, such as a history of brain disease, diabetes, and hypertension. But early onset Alzheimer's is believed to be strongly influenced by genetic factors. Early onset Alzheimer's, also known as familial Alzheimer's disease, is strongly influenced by genetic factors, as I said before. Mutations in the genes that code for the presenilin 2 protein, found on chromosome 1, presenilin 1 protein, found on chromosome 14, and amyloid precursor protein, which is found on chromosome 21, have been found to be the major causes of early onset Alzheimer's. Once diagnosed with Alzheimer's disease, patients are categorized into three states based on severity. The first is mild Alzheimer's disease, which presents with memory loss and cognitive dysfunction, such as behavioral and personality fluctuations. The next progression of Alzheimer's disease is moderate Alzheimer's, which is categorized by worsening memory loss and recognition, as well as inhibitions in language and reasoning capabilities. Finally, severe Alzheimer's disease is associated with significant impairments in communication and complete loss of independence. Patients in this stage of Alzheimer's disease are very often confined to bed rest for the rest of their lives. Luckily, there are some methods to prevent the progression of Alzheimer's disease. Maintaining a healthy diet high in fruits, vegetables, and grains can help slow the development of Alzheimer's. An active lifestyle also helps to prevent Alzheimer's disease from developing. This prevention has been attributed to the increased health of the vasculature of the brain, which helps to keep the neurons healthy. Lastly, working your brain also helps to prevent Alzheimer's disease. Examples of this include playing mentally stimulating games such as chess or keeping an active social life.
Alzheimer's has a large impact not only on the life of the individual, but also on the lives of those who take care of the person. There is a large financial impact on families who need to take care of a member with Alzheimer's. The cost of daily care, assisted living, or long-term care facilities can reach up to thousands of dollars a month. Even with the help of insurance, high premiums and copays could still lead to a very difficult financial situation for a family. Because of the high cost, the quality of care given to an individual may be compromised. Around-the-clock care might be sacrificed, or the type of long-term care facility chosen might not be what is best suited for the person affected with Alzheimer's. This, of course, as a whole, may affect the well-being of a loved one with Alzheimer's, and compromised care should be avoided at all costs. Finally, in addition to a financial component that Alzheimer's has on a family, there may be other impacts as well, including emotional or mental stress. Families may feel angry, frustrated, or overwhelmed with the responsibilities associated with taking care of someone with Alzheimer's. Or, families may even feel guilty about how they treated a family member in the past now that they have this mental disease. There are a lot of considerations when taking care of someone with Alzheimer's, and it affects the lives of the individual as well as everyone around them. There are options for those with Alzheimer's. Drug therapies to slow the progression of the disease are used and may provide significant help in reducing someone's symptoms. Though there is currently no cure for Alzheimer's, a slowed progression may help maintain the quality of life someone with Alzheimer's is used to. In addition to drug therapies, a wide range of services are available, such as daily care, assisted living, or long term care facilities. Daily care is utilized by individuals who need help with day to day activities but can still function a lot on their own. As we move more towards assisted living and long term care facilities, these options are more for individuals whose disease state has made it difficult to live alone or on their own and need assistance with day to day living. With the cost of treatment for Alzheimer's being so high, there are organizations out there trying to find more cost effective treatments as well as researching for a cure. The National Alliance on Mental Illness is an organization focused on educating people on what a mental health illness really is and how they may be treated. It is a great introductory resource if you have any questions about what Alzheimer's is and what to do if you or someone you care for has Alzheimer's. The Substance Abuse and Mental Health Services Administration provides funding for research on how to prevent, treat, and cope with a mental illness. It is also a great resource for families who want to find a support group or organization to deal with mental illnesses. Finally, the National Institute for Mental Health is a leading research organization focused on finding better preventative measures, cost effective treatments, and even cures for different mental health illnesses. On their website, there are over 180 published articles related to the latest research on Alzheimer's for the public to view. Moving forward, it is important to find ways of cost reduction in treatment for those with Alzheimer's. This will allow for high quality treatment to be available for anyone with Alzheimer's and hopefully improve the mental health status of America as a whole. Research must be a continued priority so that these more cost effective treatments can be found and hopefully even a cure. Without further research, new developments won't be made and reduction in mental health illnesses in America won't be seen. Finally, it is important to raise awareness for mental health illnesses and to educate the general public. A good educational foundation on Alzheimer's and other mental health illnesses will help boost preventative measures being taken by everyone, such as a healthy diet and frequent brain stimulation. With a strong public awareness for Alzheimer's and other mental health illnesses, we will hopefully improve the public health and see a reduction in mental health illnesses.